Hey guys, my name's Jessica Burton. A lot of you I've had in class prior to communication, so hello to you guys. And to any new students that I've not had in classes prior to this, hi to you as well. This is going to be my informative speech for communications class. Just a little intro about myself. I am a working registered nurse. I work at the Daniel Drake Center in Cincinnati. I work on an LTAC unit where most of my patients come directly from the ICU or even a step-down ICU unit. A lot of my patients are ventilator dependent, and our job is to wean them off of the vent. They're either getting IV antibiotic therapies, they're there for wound care, speech, eating, just anything to get them better to where they can either go to rehab, back home, or even to a nursing home. And I bring up this little intro because I know a lot of students in this class are, excuse me, are working nurses. And I think this is an issue that a lot of us can kind of relate to. And so what I'm going to be talking about today is actually the nursing shortage. I just feel like this is an issue that is truly going to get worse before it gets better. I have personally seen and have experienced the downfall of the nursing shortage on my unit. Excuse me again. So lately at work, we have been very short-staffed, which is a huge issue, obviously, with the nursing shortage. I think in the last month, I have had at least 6 calls to either come in early to work, which would give me a 16-hour work shift, or to pick up days with a bonus or extras or what have you, which is fine because I don't typically mind to help and pick up. You know, I do work at night, so it's a little more calm, and so it's not too bad. But you know, after a while of getting called repeatedly to come into work, it gets kind of stressful, and which I think is one of the biggest problems with this nursing shortage is a nurse burnout rate. What I mean by burnout is a lot of nurses who are either, you know, working a lot to help pick up the slack, or, you know, older nurses who have been working 30, 40, 50 years, and they're having to pick up extra and pick up the slack from other nurses, or, you know, whatever reason. It's burning them out. And, you know, I've only been a nurse for a little over a year now. Have worked at the Drake Center for a year in June. And, you know, even being a new nurse, being called in, you know, a lot, has really put a lot of stress on me. And I can definitely see where a lot of these older nurses are getting burned out very quickly. And in turn with this burnout rate, it's increasing the turnover rate as well. Recently at my facility, and I know it's not just my facility, I know a lot of other hospitals, rehab centers, nursing homes, you know, wherever you are working as a nurse, they're having issues with staffing. You know, a lot of nurses are retiring, and there's not a whole lot of new nurses kind of rolling in to fill their shoes, which is again creating an issue for the staffing part of that. With the staffing issue being as it is, it's just creating a lot of problems. And recently we've lost a lot of nurses on our floor, and you know, our floor is a heavy workload. We have a lot of very sick patients, and a good nurse to patient ratio on my floor is 1 nurse to 4 patients. And there have been nights I've gone in and I've had 7 patients. And you know, when you have 7 patients that are relying on a ventilator, it's very stressful. And what I'm going into with this is, you know, when you have a nurse who has a lot of patients who may be very sick, or even in a nursing home, if you're a nurse and you have 25 to 30 patients, it starts to become a safety issue for these patients. nurses that are working these long hours or picking up extra shifts, it's leading to them, being fatigued, injury, and job dissatisfaction, which in turn it can lead to problems for the patients. Nurses who are under stress, are tired, or are just unhappy, it can lead to patient injuries, making mistakes, and medical or medication errors. And that's serious stuff. So when I say the safety issue, and your patient quality care is diminishing, and that's something that we've touched on very much in this course of getting our bachelor's, is how important the quality of care you are giving to your patients. And I personally, when I have that many patients, I don't feel comfortable, and I let my charge nurse know that. And and a lot of people I work with feel the same way, and I'm sure it's the same in any hospital or wherever you guys may be working. I hope I'm not the only one who is experiencing the downfall of this nursing shortage. I truly feel like it's becoming a huge issue. And one thing that I also wanted to bring up is a lot of us are here getting our BSN because we know that it's going to further our careers and give us more opportunities to maybe work at places that won't hire you unless you have a bachelor's, which is something I think might be another problem. A lot of people, as myself, chose to go the associate's route, 2 years and done, which was fine, but when it came time for me to find a job, it was very, very difficult. I happened to get lucky and know the nurse manager on this unit at Drake, so a lot of these places are only accepting bachelor nurses, which is great because, having your bachelor's is like having a golden ticket, basically. But nowadays, having your bachelor's seems more of a standard of practice than it does as an extra. And I truly feel like if places were more adamant to be hiring associate nurses rather than a bachelor nurse, I feel like the whole turnover rate could be decreased a little bit. If you have a hospital that's only going to be hiring bachelor nurses, which, according to the American Nurses Association, a lot of people are not enrolling in school to get their bachelor's or pretty much anywhere because the number of instructors has decreased as well. So, you have a lack of bachelor prepared nurses, yet you have all of these associate nurses who are having such an issue finding a job. Why not fill the void of these bachelor nurses that certain hospitals are wanting to hire? Hire some of these associate nurses to fill their shoes and maybe offer them an incentive. I know a lot of hospitals are going towards the magnet status. Why not, offer these associate nurses, which I know a lot of hospitals are doing, give them 2 years or even 3 to 5 to obtain their bachelor's and, give them some motivation to want to go towards a bachelor's degree. I could go on and on why the nursing shortage is such a problem, but I think the biggest issue with it of all is absolutely the patient safety and quality of care that these patients are getting. When nurses have a huge workload of patients, you're not spending a good quality amount of time in the room with a patient. You're not giving the best care possible. And I feel that way when I have 7 patients, that I'm literally going in the room, doing the quickest assessment, giving them meds, and just jumping to the next room just to be sure that I have my stuff done on time, because a lot of doctors or even nurse managers or auditors are going to track you down and say, why didn't you give this med on time? It's a major issue, and it just becomes a real big problem. And I think we owe it to our patients to give them the best quality of care and promote them in the safest environment possible. And I really hope that the nursing shortage, starts to decrease and we can start hiring more people. And I truly feel like one way that this can be accomplished is hire these associates nurses to fill the void and give some incentive or motivation to get them to get their bachelor's. So basically my whole point of this speech is I hope everyone is aware of the problem as much as I seem to be aware of the problem, and I truly hope none of you are facing this issue as much as I have at work. And I really hope it's not a problem for a lot of people. And me being a nurse, there's some days where I feel like, why did I get myself into this mess? But the bad days, the good definitely outweighs the bad in this profession. And I feel like we owe it to our patients to be happy in our jobs. And I really hope that this nursing shortage gets better soon, and I hope none of you are facing any problems at work because of it. So that's my spiel. I'm not very good at speeches, so I hope some people feel the same, and I'm so open to any discussion or opinions you may have regarding the issue. So that's my story. And from nurse to nurse, I hope that this is an issue that we can solve. Okay, thank you.